Hi, welcome to Medical Tips You Need to Know. I'm Patty Rea.
And I'm Corinne Mogenis, and today we're going to discuss untreated hypertension, the silent killer. We have a guest on today, and we're going to do an interview with Dr. Timothy Sass. Patty?
Dr. Timothy Sass, welcome.
Thank you.
It's a pleasure to have you.
Pleasure to be here.
Can you tell us a little bit about your background and about Princeton Internal Medicine?
Sure. I'm actually a family doctor in the Princeton area since 1992. And I'm a member of a 4-member group of doctors called the Princeton Internal Medicine Associates. Some of the listeners may know some of my associates. I'm associated with a Dr. Anthony Rhoda, a Dr. Mark Schaefer, and also Dr. Gita Srinivasan. And I'm also a graduate of Georgetown University and George Washington University Medical School.
Very impressive.
Thank you.
What we're going to do is talk a little bit about hypertension, and Dr. Timothy Sass has a specialty, so we're going to ask some questions. First, what exactly is hypertension?
Hypertension is basically a fancy word for high blood pressure. It affects 1 out of 4 adults, and it contributes to a host of systemic conditions that can affect us later on and affect our health in a negative way. Basically, our heart generates a certain amount of pressure to get the blood through to the rest of the body. And sometimes if it has to generate too much pressure, that can harm us later on in life.
What are some of the risks associated with high blood pressure?
Some of the risks is, well, it contributes to 2 of the top 3 killers of mankind, which is heart disease and also stroke, namely the 1 and number 3 killers. But it can also lead to kidney disease, kidney failure, and also sometimes retinal hemorrhages.
Now, what is the way that you monitor blood pressure?
Oh, that's a good question. Sometimes we just pick up high blood pressure just accidentally by seeing someone for the routine office visit there. But once we've established that they have high blood pressure through a series of high blood pressures, we have them come in periodically and check it. Also, we'll check it at their physical exam as well and see how they do.
Why is it called the silent killer?
Well, for a couple reasons. Both it's silent and it's a killer. Like I said, it contributes to the 2 of the top 3 killers of mankind, again, which is heart disease and also a stroke. And it's also silent because the majority of people don't even know that they have it. And it's also picked up accidentally. It's only non-silent when it's extremely elevated.
How are patients usually diagnosed with high blood pressure, and what is the treatment for high blood pressure?
Okay. Again, often, sometimes on a physical examination, when they come in, we'll see that their blood pressure is high. We don't make a diagnosis of high blood pressure on 1 reading or even on 2 readings, but on 3 consecutive readings. It's sort of like baseball, 3 strikes, you're out. So if you see 3 consecutive readings, then they have high blood pressure. The best way to treat high blood pressure is through medications. And there's basically 4 main classes of medications, and we go by the mnemonic A, B, C, and D. There's the A class, which is called the ACE inhibitors or the ARBs. There's another class called the beta blockers. There's another class called the calcium channel blockers, and finally the diuretics. And each person is different. You look at each person as a different individual, and sometimes one class may be better for one person or another person than another person. For example, if someone's a little bit anxious, then the beta blockers may be a good choice for them because they sort of relax them and also relax their blood pressure.
Now, are some of the reasons that you wait for the 3 high readings because people tend to get nervous when they come to the doctor's office and they call it the white coat hypertension, where sometimes you'll get high readings just because they're there?
And that happens all the time, especially at a physical. You never make a diagnosis at the time that they're a physical because they're a little bit apprehensive there. And so you want to see 3 consecutive times. And if they have it up twice and then the 3rd time it's normal, then you sort of reset the clock, so to speak. Now, sometimes people think that they have white coat hypertension. They say, oh, my blood pressure's up because I'm very nervous. But one of the ways that we can assess whether it's truly white coat hypertension is by looking at their heart rate. If someone comes in and the blood pressure is high and the heart rate is, they're pounding very fast, then you think that they might be anxious there. By the same token, if someone comes in and says, oh, my blood pressure's up because I'm here with a doctor, but their heart rate is very relaxed, it's going boom, 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 you think that it's a true high blood pressure, and it's not because they're anxious. Sometimes they want to say it's white coat hypertension, right, but it really isn't.
What are some of the long-term effects on the body of medications for
High
use-
blood pressure. Well, you
Right.
have to, like I said, individualize it, because sometimes one medicine may be good for someone and another medicine may be bad for someone. For instance, with the beta blockers that I alluded to, years ago I had a patient who came in whose name was Gladys, and she was a very anxious person. And I put her on a beta blocker, and she came back and she's very grateful. She said this was the most relaxed she's ever been in her life. Then I had another high-powered attorney who came in, and it was the same thing with Gladys. High-powered, anxious. We put him on the beta blocker. Blood pressure came down. But he came back and he said, you know, Dr. Sass, I think I'm going to have to go off the beta blockers. I appreciate the fact that my blood pressure is normal, but I learned something about myself. And I realized that these medicines are making me too mellow, and I can't get all the work that I need to be done. So he said, I have to go back and be that person that I was before. So he picked a different blood pressure that was better suited for him.
How am I going to go on trial and be Mr. Mellow when I have to
Yeah,
be
gotta be
an animal?
aggressive.
All right, a shark.
What are some things that people can do to avoid getting hypertension?
Okay, that's a very good question, actually. Well, one of the things I'd always tell people is change your parents, but you really can't, because a large part of it is genetic there. But you can lose weight. That also helps. It's been shown that if you can lose just even 10 to 12 pounds, that can make a profound difference in your blood pressure. Also, aerobic exercise can make a profound difference as well. Also, a lot of the things that we consume affect our blood pressure. For instance, alcohol can make a difference there. Also, if we smoke, that can also constrict the blood vessels and get the blood pressure up as well. Having a high salt diet can also do it. And caffeine. We all like a little caffeine in the morning, especially as we get a little bit older, but sometimes excessive caffeine can do it. So all things in moderation.
Now, when you said something about changing your parents, blood pressure is something that is very genetic. I mean, people should really know their family history and be aware of that, because it really can come into play with their own.
Absolutely. I'd say the vast majority of people that I see that have high blood pressure, there is a family history. It's just, you know, you keep waiting for someone to say that, you know, there's no family history of it. But usually it's the mother or the father that has high blood pressure, or both. So that's, unfortunately, a very strong risk factor. Now, despite the fact that you may have been dealt a bad deck of cards with the genetics, there are things that you can do, like I said before.
Mm-hmm.
And another thing that you can do, the $64 question, is how can you reduce stress in your life? But reducing stress can make a difference. I personally find that exercise is a good means for me to keep myself healthy and keep my weight down, and also get rid of the stress in our lives.
And that'll help with your health all the way around.
All the way, it just makes you feel good. Yeah, even after you exercise, they say that you release endorphins, and there's a little chemicals that make you feel good, so it's sort of a natural high.
I know high blood pressure is the silent killer. How does high blood pressure affect the other organs in your body, like kidneys,
And all
things like that? Yeah.
It can affect almost everything there. I mentioned how it affects the heart. That can give you coronary artery disease, which means a heart attack there. It can also lead to an enlarged and weakened heart, and it sometimes can lead to heart failure. And there's a condition called cardiomyopathy, in which the heart is very weak and flabby. And what's so terrible about that is that the lifespan for these people that have cardiomyopathy is almost identical to someone who has cancer. So you think that if you had cancer, you have a short lifespan. If you have heart disease, that's much longer. But statistics have shown that if you have a very weak heart, that you don't have very long to live, actually. So it's very important to keep your blood pressure down so it doesn't enlarge and weaken the heart.
Right.